La ilaha, la ilaha, la ilaha, la ilaha, la ilaha illallahu Muhammadun Rasulullah. La ilaha, la ilaha, la ilaha, la ilaha.
The eyes can see about 200 degrees centigrade in directions, seeing the front, the peripheral right, and the left side of the body. As we all know, that as we go, certain part of our body may grow with us. The eyes is particularly important because without sight, life may be very difficult. In the morning, we also talk about the joint being another organ of the body that may age with us. But if the joints are affected, we may use walking stick, we may use wheelchair, we may still be able to function on our own. But if the sight is affected, mostly that individual may not be able to function on his own. That's why as we grow old, we must pay certain attention to our eyes and continue to pray that Allah preserve the eyes for us as long as we live. Looking at the eye generally, there is an outer part of the eye. One of the outer part of the eye is the iris. And as a form of description, the iris is the colored part of the eyes. And depending on your eye color, the iris might be any shade of blue, green, hazel, or brown. If you look at our eyes, the black side, if you look through the black side, you will see a brownish substance. At times it is like brooms, surrounding a pinhole in between it. That part is the iris. It may take any color depending on the color of the individual. If you look at my own, it may be different from that of the eye missionary in charge, because of our ethnic background. So depending on the race of that individual, the color of the individual, the iris may take different color. There is also a cornea. It's a climb dome shape over the iris. If you look at that part which I have described, the black part, there is a transparent dome substance on the iris. That's the cornea. Water and collagen makes up the cornea. The tears that is formed in the cornea protect the cornea and keeps it lubricated. We also have the pupil. The pupil is the black circular opening or window in the middle of your iris, and it is through that pupils that light actually enters into the eye. If you look at that black area that I've described, if you look into the middle, there is a pinhole substance in between it, and that's what we call the pupils. That's actually the entrance where light enters from the outside world to be processed at the back of the eye. We'll still get there as we move on. That iris can actually expand and contract depending on the amount of light that is entering. If you enter a very sunny area and the light is too much, your pupil will contract a little to reduce the inflow of the light. And if you are in a lighting place and they take you into a dark room suddenly, with time, the pupil will also dilate to give room for more light to enter. You now see that you can see a little in that dark area. So that's the pupil. Also, when people die and you see us testing their eye, it's the pupil that we are looking at. When individual still lives, the pupil can actually contract and dilate when you shine light on it. But when an individual dies, it cannot do that. It will be dilated. You now know that, okay, this person is there. So when you see us examining patients to confirm them dead, and we are looking at bringing light to look at the pupil, we will write that the pupil is dilated. And when that is seen, it might actually be a sign of death. We have the sclera. The sclera is the whitish part of the eye. That one is clear. All this white that is around the other part, we have the black part in between. The other white part is what we call the sclera. We also have the conjunctiva, and the conjunctiva is a thin layer of tissue that covers the entire front of the eye except the cornea area. On that whitish part, that is sclera, we also have the conjunctiva covering other parts of the eye. Then we have the lens. The lens sits behind the pupils. You know, I said the pinhole in between is the pupil. So behind it is the lens. And what the lens does is to help us focus the light that is coming. And it sends this focused light to the back of the eye. That's when your lenses are not working well again. You now go and use eyeglasses. The eyeglasses are also lenses. So what they help us to do is to help us converge or diverge the light that is entering so that it is now directed towards the retina that is at the back of the eye. Then we have the retina. The retina is a collection of cells that line the inside of the back of the eye. So if you look at the diagram, when light enters through here, the retina is somewhere around here. It's a collection of nerves at the back of the eye. And what it does is it contains nervous system, and the retina senses light. So when the light enters, it has entered through the pupil, the lens has converged or diverged it based on how much it wants to focus it on the retina. Once it gets to the retina is able to now dictate them as light. Electrical impulses, or what we call neural signals, that are now sent to a part of the brain for interpretation to now see that you are seeing a particular image. The retina has some rods and cones in it. We will not go to those details. Also behind the iris and pupils of the outer eyes, okay, is the lens. I've mentioned the lens earlier, that it focuses the light. So when light enters, the lens converges to focus it. It then goes into the retina. So when it gets to the retina tries to interpret it as a light energy, convert them to electrical energy or electrical impulses. These are now carried by what we call the optic nerves. The optic nerves now carry this electrical energy into a part of the brain for interpretation. And this is now converted to image, and the ability to see will then occur. Therefore, if there is any problem in this pathway that I have mentioned, sight might actually be affected. We also have the macula, and the macula is a small area in the part of the retina. That one is responsible for central vision and helping you to see fine details and color. Some people, when they walk, they will not see what is in front of them. They may not be able to see anything that is directly in front of them. If the macula is also affected, that may occur. We also have water in the eye. Before the pupils and the lens is the aqueous humor, and at the back of the lens, around the retina, is the vitreous media. Water that helps us to cushion the effect. They serve like a shock absorber in the eye, so that they keep all those structures that we have mentioned in place. So if there is any issue with the water too, the eye can also be affected. Also, that eye too can also excessively become more than what they should be, and that's what we call local hypertension. As you have hypertension in the body because of blood, you can also have hypertension in your eye because of the increase in the water content. And also have the muscles around the eye supporting it, and the muscles are the one helping us to look without moving your head. You can actually see this side, look up, look down without actually moving your head. So it's the muscles that are controlling that. So let's now move to common problems of the eye. We have what we call age-related macular degeneration. You know, as I said earlier, the macula is within the retina, and it is the one that is responsible for central vision. So when, as individuals grow older, this macula can degenerate, and when they degenerate, the individual loses central vision. And an individual may see somebody come, and you will not be able to recognize that person, or the person moves very, very, very close to you. So that's because of the macular degeneration that comes with age. There is also what we call amblyopia. Amblyopia is a condition that we also call lazy eye, and this is a condition that can happen to an elderly, but usually start from childhood. And in this case, one eye can see better than the other. One eye will start to become lazy, while the other one can see very well. And because God had made it a pure organ, you may actually not know that anything is happening, except maybe you close the very active one, and you now see that you cannot see very well with the other eye. We also what we call astigmatism, and this is a problem with the curve of the cornea, making it difficult to focus light into the retina the way it should. When you see people growing older, they will now be able to read either far object or near object anymore, because the lens is unable, the cornea is unable to focus the light again on the retina. And with this, that individual may need contact eye to help and support that. We also what we call chalazion, and chalazion is an oil-making gland in the eye. If you get blocks, that back part of the eye can now become swollen. That's what we call chalazion. We also have style, which is a red painful lump on the edge of your eyelid, and it may be because of bacterial infection. You see some people around the eyelid here, there will be some swelling there that will be painful. It's chalazion. If it is big enough, it can actually occlude vision. We have uveitis, and this is an inflammation of the iris, and when the iris become inflamed or infected by bacteria or virus, that may occur, and that may also affect our sight. We also have what we call conjunctivitis. That one is the more common that we see. When that white part of your eye is red, maybe because of Apollo, we also cause conjunctivitis. Even if they have Apollo, it can be because of bacteria, virus, or any other thing. We have what we call diplopia, double vision. As you grow older, you may start seeing things double. Instead for you to see things as one and see it clearly, things will now become double in your eye, and you will not be able to see them very clearly. That's diplopia. We also have what we call hypermyopia, which is long-sightedness. You are able to see what is far away from you, but you are not able to see what is closer to you. Such individual may not be able to read the Quran again at that point. They may not be able to read books again and all that. We also have what we call myopia. That's short-sightedness. You can see what is close to you, but cannot see what is far away from you. Such individual will now start having problem with driving. Because when you are driving, you will not even see that there is a vehicle in front of you or somebody want to cross until that person gets very, very close to you. So those are issues that may happen as we go older. We also have hypertension, which is bleeding into the eye. We also have strabismus, which is the problem with the eye, not being able to see other directions. And in this case, it may be that the brain is favoring one eye. It usually happens in kids. And also what we call keratitis, and that's inflammation of the cornea. But the ones that are very important that we should look out for as we grow old are the following. We may begin to have dry eye as we grow old because of the reduction in the production of tears in our eye. And we do start having itching in the eye. It will be irritating us. It will disturb our vision. So we may need to see doctors for us to be able to solve this, because the ability to produce tears are getting reduced, and those tears are the one lubricating the eye and preventing it from getting dry. We also have what we call optic nerve neuritis. You know, when I mentioned earlier, I said that when retina converts the light energy to electrical energy, it's the optic nerve that will carry it to the brain. So with aging, there may be inflammation of the optic nerve, and with this, the ability to carry the electrical impulse to the brain may be affected. We also have what we call pterygium, that is common in the elderly. You start seeing some fleshy growth on your sclera, the whitish part of the eye. It will now drag from the black part either towards this side or towards that side. If you look at the eye of people beside you, you may be able to see that they are like fleshy substance growing still in the whitish part of the eye. And when they grow too big, they may start occluding the light pathway of the eye. They will be preventing light from entering the cornea and the lens. We also have what we call presbyopia, and this refers to the loss of ability to see close object or small print. That's what that I say usually happen when you're unable to read Quran again. And as you force yourself to read it, you now start having headache and all that. It may also happen in children. And if you see some children that they are not brilliant in school, it may not be that they are not actually brilliant. They may not be seeing the block clearly. Or they may have presbyopia and not being able to read clearly, and that may just be their problem. There is what we call retinal detachment. As we grow old, our retina can just misbehave and detach from the back of the eye. and with that, we will not be able to see again. That actually causes sudden blindness. You can also have what we call retinitis. In this case, the retina is still intact there, but there is infection of the retina and inflammation occurs. We also have what we call diabetic retinopathy. It's a common disease in the elderly, especially those who have diabetes. And because of the high blood sugar that they have, there is damage to the blood vessels of the eye. And eventually, blood starts leaking into the retina, and this can also affect vision. Another common one is cataract. And cataract occur when whitish cloudy areas develop in the lens. When you look at that middle part of the eye, that pinhole part, in some people you just see white in there. Cataract is very common. The whiting will just be there, occluding that place and preventing light from entering. That person will not be able to see again. But one thing about cataract is it can be removed. And once it is removed, the person starts seeing it immediately. When you see us doing eye operation to individuals, and after the surgery they start dancing and say, I can see, doctor, most likely it is cataract because it is simple. Just go in to remove that whitish substance that is occluding the cornea, and then you will be able to see again. Usually, surgery is the modality of treatment. We also have what we call glaucoma. Glaucoma is the most dangerous eye disease ever known, at least for now. And this is when there is hypertension in the eye. Gradually, eye pressure builds up in your eye because there is fluid in the eye, and you may not know. And what the eye pressure does is to keep on destroying the retina and other organs in the eye, and those destructions are irreversible. So it is at the point that you know that you may be able to stop it, the vision that has been lost cannot be restored again. And even when surgery is done, that individual will not get worse in terms of the blindness, but the individual cannot recover to the kind of sight he used to have. And that's why if you are above 40, it is recommended that we should go to the hospital to do what we call tonometry. Try to take the pressure in our eye regularly, so that if there is glaucoma, we'll be able to detect on time before they damage the other part of our eyes. For retinal treatment, you can actually use some eye drop to reduce the pressure. There can be other medication, there can be laser treatment, and also surgery can be done. Also, we have age-related macular degeneration. As we go older too, the macula in our retina can also become degenerated, and this affect our central vision. All the things I've been saying since morning, they look like jargons. So let's move to something that makes sense a little. Let's look at how we can prevent all those jargons that I've mentioned, because they may not really make sense. So what are the preventive strategies? Number one, as we go old, we must start staying away from electronic devices, staying too close to electronic devices. For those who work on our laptop and computer, we start taking them far away from our eye. For those of us who do most work on our phone, we should start reducing it or take them away from our eye. And the other thing that we can do is to actually use some screen to guide our computer, so that the effect of the light from those computers or our phone, the light rays, the effect may be reduced. The other thing we can do is to start eating balanced diet. Because most of the thing in the eye, the retina, the macula, the optic nerves, they are nerves. They need nutrients. So the better nutrients we take, fruits, vegetables, balanced diet, the more we enrich those nerves, and the better they are able to perform their duty as we go older. So taking balanced diet can also help prevent the disease that we have mentioned in our sight. Also, we should maintain a healthy weight. We should ensure that we maintain a healthy weight. A healthy weight is a weight that will give us a BMI that is normal. When you divide your weight with the square of your height, let's say I weigh 70 kg and my height is 1.6. If I divide that 70 with 1.6 square, that's 1.6 times 1.6 below, and my weight is above, the normal BMI should be between 18.5 and 24.9. Maybe myself and some few people will have it here. The acting admitted should have a BMI close to that. Not many people will have such BMI, and that's the normal BMI. We can also calculate it when we get home. So the taller we are, the better our BMI is if we are adding weight. For those who are short, ensure that you prevent adding weight, because if you add a small weight, it will increase your BMI. By the time we move to 25 to 29.9, we have become overweight. That one is still manageable. Exercise can help us reduce it. By the time we move to 30 to 34.9, that's obesity grade 1. By the time we move to 35 to 39.9, that's obesity grade 2. When you are 40 and above, it is morbid obesity, obesity that will kill. That's the meaning of morbid obesity. So as we also eat and exercise, let's be checking our BMI regularly and see that we are maintaining a healthy weight. A healthy weight will also prevent us from having hypertension and diabetes. Hypertension and diabetes will cause destruction in our eye. That's what we call hypertensive retinopathy. That's what we call diabetic retinopathy. So maintaining a healthy weight will also help us reduce the incidence of hypertension and diabetes and the effect on our eye. This may not be too useful to us. We should avoid smoking in any way. Smoking is a cause of all cancers, all problems in the body. I know we don't smoke here, but for anybody who smokes, we should shun smoking altogether, because it will damage our eye as we grow older. And if we work in areas where we need to work with computer, areas where we work with dust and all that, let us ensure that, or areas where we work with glasses, those who do all these glass materials, or those people who do welder, as we grow older, we must ensure that we use protective goggles at all time at our workshop, so that it will prevent the effect of those occupational hazard on us. So let us ensure we use protective goggles at all time. For doctors who do surgeries, we must put on protective goggles when doing our surgery because of blood splash and all that. Also, when there is any trauma to your eye, either by chemical, by dust, by anything, let us ensure that we wash with a copious amount of water. Water is a natural solvent. Water is it can remove a lot of things. So if there is any injury to our eye, the first thing is, let us put our eye under a running water and allow water to flood the eye to help us rinse that chemical or that object away. Then as we grow old, maybe once in a year, we must do regular eye screening. And luckily for us, Ansarullah does high care services, doing our outreaches on yearly basis. Maybe we can test other SAP, so that during Ijtema like this, every Ansar must test their eye before they go home. That means we put prayer on Dr. Moyele and Dr. Ambali, because they are the optometrists and ophthalmologists among us. But as we grow old, at 40 years of age, maybe once in a year, we can go to our ophthalmologist to do our eye test, including tonometry, to test the tension in our eye to prevent glaucoma. Also, when there is any problem with our eye, don't let us play with it. Yoruba people will say, "Oju ni fitila ara." Don't let us do. Let us go to a hospital straight. Whether the eye is red, there is discharge, there is itching, there is reduced vision, let us go and see a doctor straight. A eye doctor for that. If you come to me, I'm not an eye doctor, I will refer you to an eye doctor. So you can go to eye doctor straight, so that they can help us look into our eye and give us appropriate treatment. Also, if you have a recommended glass that you are using, ensure that you go to the hospital to test them regularly. Some people, they will give them a recommended glass. The glass will not see very well again. They will just go to one malam by the roadside to go and buy another one. It shows that your eye is getting worse. So go to a doctor, let them test you again. If there are things they can do to reduce the reduced vision, they will do it. If you need another eyeglass, they will give it. And whenever we have a problem, let's always see our family physician and an ophthalmologist for treatment. That's in English. Ní Yorùbá, ojú ni fìtílà ara. Àwọn structures tó wà lójú wa pọ̀ gan. Àwọn bí ìmọ́lẹ̀ ṣe ń wọlé láti ta, ó níbi tó máa gbà wọlé. Ó láwọn tó jẹ́ pé máa jẹ́ kó lọ sórí retina. Retina yẹn ni bí òun ló máa bá wa convert iná tó wọlé yẹn sí electrical energy tí brain máa understand. A ní optic nerve náà lójú yẹn. Tá bá wa gbé electrical energy yẹn lọ sí inú brain wa, tí brain wa wá interpret tá máa fi rí nǹkan tá máa rí. So tí wàhálà bá ṣẹlẹ̀ pẹ̀lú àwọn ìta lè rí nínú ojú wa níta ń bí, àbí àwọn ihò tí iná yẹn ń gbà kọjá, àbí retina tó wà nínú yẹn, àbí optic nerve wa, àbí that part of our brain, èèyàn lè má ríran. Tẹ́lẹ̀ mi bá last den tó bá fi bí area àbí tó fi ń ríran nínú brain ẹ̀ gbálẹ̀ tó bá wà conscious again ó lè má ríran mọ́. So in that pathway anything may go wrong tó fa ká má ríran. Tá a bá ti ríran dáadáa mọ́ àwa lè má mọ̀ ètò go wrong níbẹ̀, ó yẹ ká lọ rí àwọn dókítà wa ni kán lè bá wa wò pé ibo ni wàhálà yẹn ti ṣẹlẹ̀, kán lè bá wa fi solution sí. Ẹlòmíì ọdọọdún ló máa ń change eye glasses and Dr. Ambalẹ̀ ti bá mi change ẹ̀, nǹkan tó ń ṣe òun ṣe eye glasses, nǹkan míì ló ń ṣe. wọ́n tó kó ti bìlí ìpẹ́jà máa fún mi glass a kàn máa change glass yẹn repeatedly ni wàhálà àṣojú yà máa tó wá wọ́ọ̀sì sí. So àwa sọ pé kí ni àwọn nǹkan tí àwọn disease ojú tó common òun làwọn cataract, glaucoma, macular degeneration and all that. Tá a bá ti ní any one of them ẹ ká lọ sí hospital ni. Àwa ló láwọn nǹkan tá a lè ṣe tá a fi lè dáàbò bo ojú wa. Alákọ̀ọ́ tá a bá ti ń dàgbà ẹ má yẹ ká máa súnmọ́ tẹlifíṣọ̀n, súnmọ́ laptop wa jù, àwọn fóònù wa náà ká máa gbé súnmọ́ ojú jù torí àwọn light ray tó ń jáde ń bẹ̀ yẹn á máa affect ojú wa. Ẹ rí i pé bá a ṣe ń dàgbà sí àárín fóònù dáadáa mọ́, èmi gan bí mo ṣe ń rí fóònù ti ń reduce díẹ̀díẹ̀, so àgbà ti ń dé díẹ̀díẹ̀ nìyẹn kéèyàn lọ máa yẹ ojú ẹ̀ wò. Lẹ́yìn wá àgbà yẹn ká rí i pé à ń jẹ balance diet ní gbogbo ìgbà, ká máa jẹ ẹ̀fọ́, àwọn ewébẹ̀ àti èso dáadáa. Tá bá wá sí Ansarullah meeting a máa rí i pé wọ́n ní wọ́n kọ́ fún wa ní watermelon, gbogbo àwọn kinní yẹn àwọn bàbá tẹ́jú oṣó ló máa ń ṣe, wọn ò fẹ́ kójú wa darúgbó ni, wọ́n fẹ́ ká jẹ ká tó jẹ náà máa ń jẹ so that àwọn nutrient yẹn wọ́n á lè help ojú wa. Àṣẹ́gẹ́ bí àgbàlagbà fruit and vegetables ó dáa fún wa gan. Lẹ́yìn wá àgbà náà ká rí i pé àsanra jù. Tá bá ti ń dàgbà tendency nípa máa dọ̀gá lẹ́nu iṣẹ́ àti fẹ́ máa ṣiṣẹ́, a máa jókòó sórí chair, a máa give directive, go and do this, go and do this. Àwa ni chief executive, and because of that sedentary lifestyle pé à ń jókòó púpọ̀ yẹn a máa bẹ̀rẹ̀ sí í sanra. Tẹ́ bá di hospital àwọn nurse tẹ mọ̀ nígbà tó ṣì young tí wọ́n smart tó máa ń lọ káàkiri ẹ máa rí pọ́n ti sanra ní ìsìngbà tó di matron. Tó bá ti di matron tendency ni pé wọ́n kàn máa direct ni go and do this, and if care is not taken wọ́n máa acquire weight. Àwa náà gẹ́gẹ́ bí ọ̀gá ń bi iṣẹ́ wa bóyá tailor ni wa ránṣọ mọ́ ó yá ẹ lọ ránṣọ yẹn a kàn máa grow weight ní a gbọ́dọ̀ ṣe nǹkan lórí weight wa. Ká máa ṣe exercise yẹn lè jẹ́ pé nínú compound wa ká kàn rìn round compound wa for 30 minutes ó ti tó. Lẹ́yìn wá gbà yẹn ká má máa mu sìgá, mo mọ̀ páàkì mu sìgá ń bí. Àwọn tó bá ṣiṣẹ́ bíi weather tá ìṣe pẹ̀lú glass tó lè ta sí wa lójú, tá ìṣe bíi tí dust wà ẹ ká máa lo goggle at all time tá bá ti wà ní ibi iṣẹ́. Lẹ́yìn wá gbà yẹn tá bá ní any injury sí ojú wa ẹ ká kọ́kọ́ fomi ṣan gan-an ká jẹ́ kómi pọ̀ mẹ́ ká fi ṣan kó lè neutralize either chemical or nǹkan tó wà mẹ́ kó má bàa damage ojú wa. Lẹ́yìn wá gbà yẹn ní ẹ̀ẹ̀kan lọ́dún ó kéré jù ẹ ká máa yẹ ojú wa wò, wọ́n bá wa wo ìta ẹ̀, wọ́n bá wa wo ẹ̀yìn ojú wa, wọ́n á ṣe test wíwá pressure ní ọ̀pọ̀, wọ́n á lè sọ fún wa pé ojú wa ṣì wà pa, ká máa ṣe lẹ́ẹ̀kọ̀ọ̀kan lọ́dún báyìí. Sọ àti wàhálà bá máa ṣẹlẹ̀ wọ́n á tètè mọ̀, wọ́n á lè bá wa correct ẹ̀. Lẹ́yìn wá gbà yẹn àwọn tá a bá ń lo recommended glasses ká máa lò lọ, but tá a bá ti fi ríran dáadáa mọ́ ẹ ká lọ rí àwọn expert, àwọn ophthalmologists àbáwọn ophthalmologist kọ́ bá wa tún wò padà kán lè wò pé ṣé nǹkan mi ṣẹlẹ̀ sí wa lójú la fi ríran àbá glasses yẹn ló ti weak, ká má kàn rà ní ẹgbẹ́ títì. Lẹ́yìn wá gbà yẹn tójú wa bá pọ́n ó ń yọ pin ó ń yọ anything ẹ má lọ sí roadside chemist láti lọ ra oògùn o, ẹ ká lọ rí doctor kó bá wa wò kán lè kó oògùn tó jẹ́ original fún wa. Kọ́lọ́n bá kó ràn wá lọ́wọ́. Assalamu alaikum warahmatullahi wabarakatuh.